Well, people always put a G in my name instead of
what is with the extra letters?
McGiven. They always say McGiven. I'm like, where is the G, man? Like I get McNiven or Mag, whatever.
Yeah.
I don't know the G.
Yeah, the R. People put an R in my name. Camenga.
I do that, actually. When I wrote it today, I actually put the R in there.
I'm like, where is the R? The car. I mean, because we like cars, I guess. I don't know.
I don't know what it is. Welcome back to our favorite part of the week. It's time to listen to Sounds of Health, where we share the stories, people, and resources that help others to improve their physical, emotional, and financial well-being. Whether you consider yourself a health enthusiast, a wellness warrior, or if you're simply looking for information, guidance, or inspiration, you've come to the right place. We want to take a minute to thank everyone out there who's listening to the podcast and helping us to share the sounds of health. The response we've received so far has been fantastic, and we hope to continue growing our listenership and reaching more people far and wide. So please be sure to follow us, like, share, leave a review, and if you know anyone who you think should be a guest on the show, be sure to email us at soundsofhealthpodcast@gmail.com. For today, I'm your host, Dave McNiven, and I'm excited to welcome the Executive Director of Interfaith Volunteer Caregivers, Dan Camenga. Did I get that right?
You got it.
All right. I was a little worried about that one.
No. It's all good. You got it.
Awesome. We're really excited to have you here today.
Well, thank you. Great to be here.
Yeah. So you and I have kind of run in the same circles for many years. As we were just talking about, our kids came up through the same school system, so probably saw each other quite a few times at all those events.
Yeah.
And then, of course, the work that we're doing with the seniors in Hamden on the Health and Wellness Council for the Hamden Regional Chamber of Commerce. You've been such a fixture there in Hamden, and it's been great getting to know you and the work that your organization is doing. So I'm so excited to have you on the show so we can help people to learn a little bit more about you.
Well, thank you, Dave. Yeah, it's funny because, as we think about the connections, the paths that we've crossed historically, right? It makes me think about community.
Yeah.
And the fact that, listen, it's all about community, right? I think wellness begins in community. And if we can somehow support that connection that people need to each other, right? Get them out of their bunkers, get them in, connected with others, encourage empathetic interest in one another. We can do a lot together.
I agree.
So it's cool to be kind of crossing paths again and working together in Hamden.
Yeah.
But certainly, Interfaith Volunteer Caregivers, we're all over New Haven County and quite frankly beyond.
Yeah, that's fantastic.
Growing. Yeah.
Great. And I want to talk about all the amazing things you guys are doing in the community. But first, tell me a little bit about your background and what brought you to where you are today.
So, my passion's always been around, for many, many years, has been around nonprofit management. The nonprofit, or as I like to think of, the social benefit companies in our community, right? These are organizations that, have mission, have purpose. They, in many ways, act like companies, but, are in many ways different, right? Mm-hmm. And their focus is certainly on social benefit. My passion's there. My passion also lives very clearly in the garden space, outdoor space, cultivated space where people can come together. And so, I've had sometimes what I describe as a nonlinear organic journey from my earlier days to now. But I'm delighted to be the director of Interfaith Volunteer Caregivers for almost 2 years now.
That's great.
And hope to be here for many more years. We have a lot of work to do, and it's a period of amazing transition and growth. I went to school initially after graduating high school, of course, down in Delaware, University of Delaware, for master's in public horticulture administration, later got an MBA, served in a bunch of different roles in several different nonprofits. Also served in some for-profits, worked at TD Bank here locally when my wife and I moved here in 2009. So, I've had different experiences. I've seen the community through those different lenses.
Yeah.
And I feel very much at home.
That's fantastic. What brought you to Connecticut? Was it the job?
Well, I was very happy at the time working as the corporate relations director for University of Rochester.
Okay.
And loved the work. It was great to be in a university environment where lots of things are happening. You get to work with lots of interesting, creative people. Every day is different, right? I love that kind of variety. But my wife was finishing up at the time her residency and decided to take a fellowship at Yale.
Gotcha. Okay.
And she was an undergrad alum from Yale, and my family has place here in Connecticut. So now my parents live here. Wanted to be closer to family. It made sense. So I said, "Yeah, let's go."
That's great.
Turns out it was kind of a crummy time to move with the Great Recession, but
right.
That's all in the past now.
Yeah.
So we make the best of it.
For sure. Yeah, that's great. So you have family here in Connecticut.
Yeah, my folks thankfully continue to live and thrive best they can as they age in Connecticut. My sister currently is in Florida, but moving up to Massachusetts.
Oh, very nice.
So back to New England with her daughters. And so it's good. Family's always been important to us.
Yeah, that's great. And it sounds like you had an eye on what you liked right from the start. You said that you majored in horticulture?
Yeah, I mean, from the time I was very young, I was interested in cultivated outdoor space and bringing people together. And I wanted to go to the longer graduate program when I was 11.
Oh,
and
wow!
Now I'm 46, so it was a long time ago. But I was really focused on that, and I did it.
Yeah.
I was proud to do it right out of undergrad. So I graduated in 2003 with that experience. And continued on. I did work at a public garden right after school in Canandaigua, New York, and that was really like a firestorm for me, thrown into the wolves' den, so to speak. Crazy situation.
Yeah.
Really hard work. I'm glad I did it, but they were suffering with debt, a foreclosure threat. Prior director had embezzled money.
Oh, wow.
And so it was real life. I mean, it was like, okay, this is what can go wrong in an organization, in a nonprofit. And, for all the good that occurs with nonprofit in the nonprofit world, there's some real challenges that can occur.
Absolutely.
And so I'm aware, though, acutely interested in, how do we create the right checks and balances, the governance structure, the board responsibility to make sure that our local organizations are healthy, protected, right, from fraud, and can continue to serve the public.
That's great. It's so important. I actually have a background in nonprofit myself. I started working in nonprofit with the Michael J. Fox Foundation when I was living in New York.
Oh my gosh, that's awesome!
And I was, honestly, it was such an amazing organization to get started with. Like they did everything right.
Yeah,
and they were the way that they structured things right from the get-go. The mission and all of the work they were doing. It was incredible. So I was kind of spoiled working for them. Learned a lot, though.
That's a great experience.
It was definitely a great experience. It taught me that I had more skills than I thought I had, because I was an actor before that and trying to, establish a career in the arts. But I'm so thankful that was my first experience in nonprofit, because I did see, that world of how to set things up properly. And it is such a passion of mine to give back to the community. Even now, today, in what I do, I mean, you can see like the volunteer work, Sounds of Health, right? Yeah. But even the insurance agency, it's the mission of it. I have a number of things that I focus on, and one of the things to focus on, obviously, because I work with so many Medicare beneficiaries, is the health of our senior population.
Sure.
That's a big part of what we're doing and what our mission is, but also our youth population. Because I think, if you take care of those two ends of the spectrum, the rest of the community figures it out, right? It all works in that way.
Well, and so often we know, right, the challenge of managing life is often trying to balance and figure out how to support those close to us, right? Yeah. Whether they be our kids at home, the logistic, and it's a joy to do it. But it's also a challenge, right? So how do we figure that out in the best way possible? How do we take care of adults, our adult parents, if they're, challenged and maybe they're living with us, or maybe they're living nearby, maybe, there's that extra responsibility.
Yeah, of course.
It's a huge challenge. And we talk about sometimes the silver tsunami, right?
Yeah.
It's coming.
Yeah.
What did you do when you were at the foundation, or you said the Michael J. Fox?
Yes.
Was it specific area? Did you get to sort of play in different spaces within the nonprofit?
Yeah, it's funny. I started out as a temp and was doing whatever they needed.
Okay.
So I actually ended up designing their phone systems because there's nobody that did it, right?
Okay.
So
Yeah,
I just
that
learned
sounds
it. I
about
figured it out. I figured out how to do all of those things. It was very strange. And then I very quickly got hired on full time, and then eventually became one of the people that was in charge of the Team Fox program. And Team Fox was really one of the first nonprofit teams that was out there. Now everybody's got a team. They're doing the New York City Marathon and things, but the Fox Foundation was one of the first. And so that really gave me an opportunity to create community around mission. And I worked with some really amazing people that I learned a lot from. And then got to go out there and really work with all of these people in the community that wanted to do something, that wanted to give back and hopefully find a cure for Parkinson's someday. So I had a very amazing experience there.
I love, there's innovation that sometimes we take advantage or take for granted, right? In the nonprofit space, this idea of, team fundraising, team support.
Yeah.
It's a 2-for-1, right? Where you can walk and chew gum at the same time. We can have fun, be in community and support at the same time. And that kind of action, that kind of support is really, I think, something that stems from the nonprofit community.
For sure. Yeah.
And I'd love to see more of it. And we learn from each other, right? There tends to be a lot of free exchange of information, ideas in that community, which I really value.
Yeah, absolutely. And, one of the things that I was challenged with this past year doing for my agency was coming up with core values and using, putting some real thought behind what are the things that we value and using those to guide our path forward. So as I continue to grow as a business, using those core values, falling back on those. And one of the ones that I really landed on was this idea of active empathy. And I've heard you say empathy a few times, but also what we're talking about with that team experience, it really is taking that empathy and creating action around it, right? So it's not just, oh yeah, I feel for you. It's I'm going to now give back, or I'm going to help you to meet a challenge or to solve an issue. And I love that idea of using your empathic nature to make the world and community a better place.
That's right. Yeah. No, you're speaking my language, and that's really what IVCG is all about. This, the opportunity to identify a challenge and to take action in support of another person. That moment when there's support being given to somebody who needs it, right, can feel a little transactional, right, at times.
Of course.
And that's okay. But it's not the transaction that motivates the behavior, right? It's not the transaction that defines the community, the people in need, the people who are giving support, right? It's the relationship behind that, right?
Yeah.
And so how do we really bring that relationship to the forefront, cultivate that, and try to scale it up, right? I'm constantly thinking about scale. How do we do more of this?
Yeah.
I want to do more of this and faster, right? All the time.
Yeah.
Like, because there's a lot of need out there, but there's also a lot of, empathetic people that are ready to help.
For sure.
And want to help.
Right.
And sometimes need a little help doing that.
Exactly. Maybe don't know the path forward to do that. Right. They don't necessarily want to take on another career, another job.
That's right.
They just want somebody to show them how they can do something to help.
Enable it.
Yeah, exactly.
Right?
Yeah. So IVCG, Interfaith Volunteer Caregivers.
That's right.
All right. So that's the organization. You're the executive director. So on the website, right under the title, it says, "We are neighbors who help neighbors live lives of connection and care with seniors at the heart." So does that really encapsulate?
That's our mission. That's our mission. And it's a beautiful statement. It's simple.
Yes.
You think you can wrap your head around it. It's amazing how much effort in a social benefit company goes into designing these comments, these statements. There was a lot of work that went into that, but I think it really does reflect who we are.
Okay, great.
And and it's consistent with the through line of where we began 40 years ago and where we are today, where we're going. It's interesting to look back. It's interesting to think about history, right?
Yeah.
But it's so important to think about where we're heading.
Absolutely, for sure. So 40 years ago, this is the 40th anniversary.
This is the 40th anniversary.
That's exciting.
Yeah. Yeah, and it's amazing. I started just about 2 years ago, and I tell friends, family, hey, I'm the new director, Interfaith Volunteer Caregivers, Greater New Haven, Inc., period. It's a long name, right? And they're like, well, what's that?
Right.
Never heard of that.
Yeah.
And I'm like, why have we been keeping this a secret? We're now in the community with service for 40 years. To be fair, our original name was different. Our original name was Downtown Cooperative Ministries.
Okay.
And so, as things do, they evolve. But that birth came from the group of congregations downtown New Haven on the Green. Several congregations said, look, we could do more together if we cooperate, if we talk, if we organize, than we're doing alone. There was conversation with a great foundation called the Robert Wood Johnson Foundation. There were conversations happening in a similar way in other communities around the country. And so Robert Wood Johnson put in some money, and there were 30 of these organizations started in 1984.
Oh, wow.
In different parts of the country.
Okay.
Out of those original 30, 15 of them remain. We're one of them, and others have started. And so, you'll see variations. Some organizations that are similar to ours, at least birthed out of the same spirit of neighbors helping neighbors, regardless of faith background, all wanting to help focus on seniors, right? Those are the core elements.
Yeah.
Some of them call themselves Faith in Action. You hear that, Faith in Action, or variation of that. Interfaith Volunteers, variation of that.
Yeah.
But they're all kind of pulling on the same heartstrings, right? And trying to advance the same goals.
Right. Right.
But we all look different, and I think if you look at our organization right now and the period of growth we're in, the period of transition, evolution, there's a lot of exciting stuff happening. And it's a collection of programs, right? Those programs reflect the interest, the passion, the experience, the enthusiasm of our community, of our volunteers, 230 of them.
That's amazing. That's really incredible.
But we're just beginning. We need more, of course.
Of course. Yeah. You want to get bigger. You want to do more.
Well, we want to do more. That's the thing. You want to do more. How do you do it? You do it with volunteers. We're super small. It shouldn't work. I tell people that it shouldn't be possible. What we do, if you just look at the paper, the financials, like this doesn't make any sense.
Wow. Okay.
Because the impact is way bigger than the money.
Yeah. Of course.
But it's because of the value of the volunteers.
How large is the staff?
I'm the only full-time person.
It. Okay.
Now, we have part-time staff.
Okay.
We have part-time staff. We have 2 part-time drivers that back up our volunteer drivers. We've got now 3 part-time people with our Experience Corps program, brand new adoption.
Great.
And I have a part-time person that helps with scheduling.
Okay. Gotcha.
But yeah, it's...
and is there a board of directors or any?
Yes, yeah. So consistent, the model, the nonprofit model, leverages and builds upon the idea that board is responsible. At the end of the day, the board is really the authority on behalf of the community. The board's represented by members, peers from the community, and their role is governance and oversight of the director. And so we have an active board. We're a small organization, again, that does a lot. And so we're meeting monthly. Every month we meet, the board and I. And so they're involved with a lot of the big decisions, of course. As a nonprofit matures, as a larger nonprofits typically build out larger staffs with, delegation, more nuance there.
Yeah.
But with a small organization, it's not uncommon to have this kind of very tight connection between the board and the ground.
Yeah. So, I mean, you're really responsible for doing a lot of things though, right? You're wearing many hats.
I feel like a lot of the hats.
Yeah. Gotcha.
I don't want to say all the hats, but a lot of the hats.
Sure. Yeah. Now, how about so you said there's 15 of these organizations that are left from the original 30.
Yeah.
Are you guys connected in any way? Do you work together?
So there is a national organization, the National Volunteer Caregivers Network.
Okay.
Which is, a sort of bonding agent for similar organizations. We're associated with other organizations that have these, national lenses as well. But that's the one that's most directly tied to that origin story.
Gotcha. Okay.
Yeah.
But you are an independent organization.
Yeah. We're independent. And, if you look at our programs, most of the work we do is focused on seniors, 60 plus folks, elders, seniors, seasoned individuals, right? Depends on whatever term you like.
Sure.
In New Haven County. Okay. So it's a big area geographically.
Yep.
If you look at one of our programs often called upon to help people, which is called Transportation Plus, it's about non-emergent medical rides to get seniors to their doctors. It's important that you have flexibility to move people around geographically, because you might have a senior living in North Haven that has to go to New Haven or to now Guilford, right, to Goose Lane. Yeah. And so, how do you make that happen? Now, there has to be a limit, and so we've defined that limit as the county.
Okay.
For that program. But, there are other things that we do that have spillover effect. And even, I would argue, the benefits to that program, Transportation Plus, adult children who are working now can go to work because they know that their loved one is going to get to the doctor.
Right.
That's huge, right?
Yeah, it is huge.
Economically, from a societal productive perspective, right? Like, you need that support.
Yeah.
And I just wish that folks would be like, realize the spillover, the secondary economic benefits that can come from a program like this. Right.
Yeah.
The fact that these physicians, these caregivers, professional caregivers that are able to now get billables, right? There's economic engine there.
Oh, absolutely.
That we're helping literally drive.
Yeah.
And a little bit from those folks to our organization could go a long way. But that's, I think about sustainability, right? Of this is always the world of the nonprofit. How do you keep the thing going?
Right. Now, the ride program, you mentioned to me before we kind of got into all of this, that's what people knew you for, right? Like,
historically,
you guys do the rides. Okay.
Yeah.
These rides, these are free rides for people?
Yeah. Right now, these rides are free. It'd be nice to be able to always keep that offer on the table.
Yeah.
Quite frankly, we'll see if that's always the way it is. But right now, there's no change. There's no plans to change that. The problem when you offer a free ride is that people call and they're like, "Hey, I'll take a free ride." Sure, right?
Yeah.
And so, people knew us as the ride organization. We're that ride organization, And I take. I push back a little bit on that, since I came on to say, listen, I have a sense that at least some people are seeing us as a taxi service,
Sure. Yeah.
Just call upon us.
Of course,
And I think, we're more than that. We're more than that. And I want to challenge people to think of us as more than that. Right. Because that's just one of the things we do.
Yeah.
A lot of the seniors who end up being enrolled in the program and get rides because they can't drive, they're isolated, they don't have family, or, there's lots of reasons. These folks will build friendships with some of our volunteers. And you'll see these volunteers will say, "Hey, I want to take Johnny Appleseed because I want to see how Johnny's doing." Right. I see his appointment. I'm going to sign up for it. And so that builds resilience, right? For that one person, right? How do you scale it up? 330 seniors who are registered on this one program.
Yeah.
It's a lot of people.
It is a lot of people. So 330 you have registered?
For just that one program.
Just that program.
Yeah. And so, and there's people that are on the waiting list to get registered. Mm-hmm. We've got friends in the caregiving community who refer people to us.
Yeah.
It's a great solution.
Yeah.
They need to get their patient to their office.
Right.
Call Interfaith. Doesn't cost them anything.
Right.
It's a great solution. But, the question is, at some point, it's like, hey, guys, we're in this together. We're happy to do as much as we can. And we fulfill over 90% of the requests that are given to us.
That's amazing.
Over 2,500 rides a year we're giving. Over 5,000 service hours of support.
Yeah.
Right? These are personal rides door to door. I mean, nobody else is doing that.
Yeah.
This is unique. But at a certain point, it's like, hey, we all like this. We all understand the value. How do we make it work? Right. And so that's the opportunity. I'm very transparent. I believe in, honesty, transparency, openness to say, listen, if we want this as a community, as a community member, I want this. for my neighbors.
Of course.
How do we make it sustainable? How do we make it work? We got to figure that out together, right?
So there's a limit right now.
Asking.
There's a limit to how many people you can accommodate.
It's a game of physics, right? I mean, at some point it's like,
right.
It's like, that's the ground, that's the sky. There's only so much you can do with it, right?
100%.
And so, listen, we've got a lot of seniors that need help. We've got about 40 volunteer drivers.
Okay.
Sometimes we've got a couple, husband, wife, love them. They're amazing. They do so many rides. They're on vacation right now.
Gotcha.
Right? Which I think is great.
Yeah, they need a vacation. Everybody needs a vacation.
Yeah, have fun, go for it. But you're like, oh gosh, how are we going to cover those rides,
Right.
And so that's a challenge.
Yeah.
And so, I call it a volunteer empowered model. Volunteers should be empowered to engage and volunteer the way that makes sense for them.
Yeah, sure.
When, where, right?
Mm-hmm.
How? Maybe they want to be in this program. Maybe they want to be in another program. I want them to be happy, right?
Yeah.
I want them to engage in a way that is going to tap their passion.
Yeah, for sure.
Right? But that also means if we're simultaneously trying to offer and commit to all these folks that are asking for help, right? How do you fill in the gaps when there are gaps?
Right.
Because inevitably there will be.
Of course.
Right?
Yeah.
So, we do have right now 2 part-timers that, quite frankly, I can't afford to, but I'm doing it anyway because it's the right thing to do. Right?
Gotcha.
But, we can make this stronger and stronger over time as people join us again and find their passion.
Yeah.
I talk a lot about opportunities, volunteer opportunities. We have a lot of them.
Yeah.
And I'm constantly looking at, Dave, how do we slice this apple into better, core pieces, right? That people want to enjoy, right? So Diapers for Dignity is another program we have. Food Force. We call it Food Force. This is about it's food equity work. It's about helping get food to those who need it, who are elders in our community, right? And so, we have about 35 people who are helping deliver groceries on Saturdays on a rotating basis all over New Haven County. And, that's their gig. They like it. That's great. So I want to support their efforts, and we make it efficient. I give them an efficient route.
Yeah.
So they're not wasting their time. They're not going from West Haven to Meriden, on the same day.
Right. That's incredible.
But that's a different group of volunteers than those doing the rides.
So you have plug and play options.
Absolutely.
Okay.
Find your path and lean into it.
That's fantastic.
And then over time, sometimes people be like, hey, that's cool. Let me also do this thing.
Yeah. Gotcha.
We have right now phone reception, right? Since we've been talking, I talk too much.
No, you're talking just fine.
But as we're talking, I would put money on the table right now, $10. There's 10 phone calls that I've gotten, voicemails. And I don't have a phone receptionist, Dave.
Okay.
There's nobody on the phone, right?
Yeah.
It's voicemails.
Okay. So you're going to be calling all those back.
Well, or my colleague Chris or Ron, they try to help out. But we've worked together as an internal team to build out what I call a phone kit, mobile phone kit. And I can actually give you a suitcase. You can adopt the phone for a week.
Yeah.
It's all there. You got a phone, you got a computer, you got instructions. You can help process phone calls for me.
That's pretty wild.
So we're trying to innovate in these different ways to say, listen, it's not just about sign up to volunteer so you can drive somebody from point A to point B. Totally important, right?
Sure. Yeah.
But there's a lot of different ways to help.
Yeah, it sounds like it. That's amazing. First of all, though, you can't talk too much on a podcast because if we're not talking, then it's just dead air. So I appreciate you filling in the dead air.
Well,
and also, that's amazing that you're coming up with these solutions, right? So people that, again, you're giving them a path forward. They want to help. They don't know how to help.
That's right.
Here's what you can do. Plug and play into what your option is.
Yeah.
Are there criteria that people have to meet in order to utilize the services that you're offering?
So we're really agnostic, and we want to be arms wide open. Listen, if somebody raises their hand and says, I need help, they probably need help.
Sure. Yeah.
I mean, most people aren't saying, I need help. Just kidding.
Right. Most. Yeah. Right. Yeah.
I mean, there are exceptions to every rule, right?
Yeah, of course.
But, yeah, we are not judgmental. I'll say it that way. You know, the criteria to join as a client side, and some of our clients, by the way, are now also serving as volunteers. They're on both sides of that fence, right?
Yeah.
Which I love.
Yeah, that's fantastic.
People have value.
Yeah.
You know, and just because they might need help getting groceries because financially they're struggling, doesn't mean they're not wonderful, smart, caring, giving people.
No,
right?
they might be great at answering the phones.
Exactly. That's what I'm talking about, right? Yeah. This is such a beautiful opportunity, right, for us to tap and to say, how do we give dignity to those individuals? Because who wants a handout, right? Like at the end of the day, you're like, listen, I need help, but I also respect the fact that this is causing somebody else to go out of their way,
right?
And I'd love to give back. How do I do that?
Yeah.
Right. Yeah. I can have them make phone calls. I can have them write, you know, on the correspondence team, right? Write letters to people. I'd love to have birthday cards going out to everybody in our community, you know, of interfaith volunteer caregivers. I don't have the capacity to send those birthday cards, right?
Yeah.
I bet you there are 5 people in the community in New Haven County that would love to do that.
I'm sure. Yeah,
right?
For sure. Yeah.
I just had to find them.
You have to find them, right? You need the time to find them, right?
Well, and the other folks in the community saying, hey, you know, have you heard about this?
Yeah, right.
Have you considered that? You know, because I bet a lot of people didn't even imagine that that was a possibility.
Yeah, I'm sure.
Right?
Yeah.
So it's fun to think about these things and dream. You know, we're growing. This is a period as we enjoy this 40th anniversary, the celebration. We're going to have October 17th at the View.
Nice.
The VUE, the View in Hamden. Beautiful space, by the way. Gorgeous. Unbelievable. I think it's going to be, like, quite frankly, one of the best, if not the best place in New Haven County. It's got a view of New Haven City. It's been renovated. It's gorgeous in there.
That's awesome.
We're going to be one of the first big events, have our gala there, 5:30 on October 17th. People can be a part of it.
They can purchase tickets.
Yeah.
Great. We'll definitely put that up on our social media channels. Help you to promote that for sure.
Yeah.
Yeah.
So, we haven't launched the tickets yet, but we will. We're working on that.
Well, you let us know.
I will.
And then we'll share it. That's for sure.
Yeah.
So you have all of these different programs. Let's talk a little bit more. So we've kind of hit on the rides. We've talked about Food Force a bit. Tell me more about Diapers for Dignity.
Yeah. So Diapers for Dignity is really critical. I mean, if you think about for folks that are dealing with incontinence challenges and who are also financially insecure, it is an enormous unplanned burden.
Right.
Like who in their, 40s and 50s is like, let me put up a savings account for adult diapers because, that's coming down the road. You don't do that. And it happens and you're like, these products are expensive. Look, we are happy to receive the product donations as family members deal with transition, members of their family pass, and they're like, I have all these boxes. What do I do with them? Don't throw them in the dump. If they're new, unwrapped, give them to us.
Yeah.
And we have our inventory room every week on Friday. We have volunteers that are packaging, trying to make those specific matches. We can't always make the right match.
Right. Yeah.
Because the inventory is based on what's contributed to us. We work with the Connecticut Diaper Bank.
You do. Okay.
As well.
So you team up with another nonprofit.
We do.
Yeah.
Yeah. As often as possible.
Yeah.
In this case, it's a logical fit. And so, we try to help as many people as possible. We have about 90 people registered right now with Diapers for Dignity.
That's great.
And it's, that's another program that's growing.
Yeah. It's funny. I mean, there's all of these missions and nonprofits that are out there that even I'm just not aware of. We had someone from the Diaper Bank in our BNI group. So I got to learn so much about what they do and the mission and it's just incredible, the work that they do.
Yeah.
And it's great to see that you're teaming up with some of those other organizations and serving a need that's in the community. Because this is certainly one nobody talks about and most people aren't even aware of. But so important because it is something also that impacts health.
That's right.
So, and it could be a very serious situation for someone.
Yeah. Well, and if you don't deal with that, right, it becomes an even more costly, more painful, more troubling issue. And so it's always better to be preventative, right? To be ahead of the game in terms of how you deal with your health.
Yeah.
And we also we love partnering. The Connecticut Diaper Bank, I think so often in the community, leads with the diapers for kids.
Right.
Infants.
Yeah.
because quite frankly, that's, I think, what sells. I think that's what helps people be inspired to support them.
Sure. Yeah.
And a lot of people don't realize they also are helping with adults.
Yeah.
Indirectly. They don't have a direct sort of client diaper bank.
Right. Yeah.
But indirectly through us and others.
Yeah. That's fantastic.
Yeah.
And then you've mentioned Experience Corps. Tell me a little bit more about that.
Experience Corps is our newest program, adoption. So again, we are a collection of programs. Experience Corps is for the advancement of literacy, K through third grade folks, okay, in our community right now in Hamden and New Haven. Although ideally the dream is to have the footprint of Experience Corps match the footprint of Transportation Plus and diapers and Food Force. That's a New Haven County commitment. But we need to grow our community of volunteers and our network of educators as well. K through third is the prime time you need to address literacy. You get to fourth grade, you can't read, you're in a hot kettle of soup.
Yeah.
Really in trouble, right?
Yeah.
It's a much different trajectory in terms of your academic advancement if you can't read by the time you're in fourth grade. So the research is clear. It makes sense to invest in that. And through Experience Corps, which is a national model that's stewarded by the AARP Foundation.
Okay.
There's sites across the country, Boston and Arizona, for example, Washington, D.C., here in New Haven County. It makes a lot of sense. It's scalable because we work with older Americans, 50 years and over, different than our client community, 60 years and over. But look, these people are not just able to help young people, right? But they get so much value out of that. And that's really what it's about. It's a two-way, it's this duality of care that I think about, right? Mm-hmm. Care isn't one direction, right? It's this kind of, relationship, right? People are in relationship. Sure. So we're thrilled to have the program. It's lived in the community for 17 years. We want to thank and credit the Agency on Aging for their leadership in that work for the first 17 years. Their willingness to see us as a valid partner in this work, and to select us as the endorsed next home. Yeah. And so we're now becoming the adoptive parent of this program.
That's exciting.
I'm proud of it.
That's very exciting. Yeah. So you inherited the program from the Agency on Aging.
Yeah, locally, the way it works is that each community that hosts an Experience Corps project program, will require a local host. Okay. And so the AARP Foundation is providing no financial support directly, but indirectly, they provide a lot of support with, messaging, with national advocacy, some of the larger national grants that can then be distributed and, benefit the local communities. Right. They deal with that. They deal with the assessments, the curriculum development, best practices, the research, the data, all that stuff they bring to the table. And so locally, we can then focus on the relationships with the educators locally, the school systems, and make sure those pairs of, senior and student make a lot of sense.
So the volunteers that are actually working are the 50 and over, you're saying?
That's right.
And you're pairing them up with a child who's identified or raised their hand, the family's raised their hand saying they need the support, or is it coming through the educator?
Ideally, it's going to come through the educator, the school system, or after-school program. We have partnership with the YMCA right now. And so, there are a few students who are individually partnered with some of our volunteers outside the sort of designated context of the school system. But those are individual cases. I think in terms of scale and how the program grows now under the wing of IVCG, we're really interested in building partnerships and, alliances with local elementary schools.
Gotcha.
That are interested in this. Now, some might not be interested in working with us. That's fine. But, literacy is not bounded by geography. Right. The challenges and the opportunities that come with it, right, are universal. So, it's a real challenge. New Haven, the city of New Haven's recognized that. The mayor has invested, not just for the K through third, but this is more general, in that as a priority. And I think we need an all hands on deck strategy, right? Yeah. This isn't the one solution that fixes all the challenges, but it helps. Yeah. And I think to give those opportunities to our seniors.
Yeah.
really important.
Yeah. I mean, as you have touched on a couple of times, when you're volunteering, when you're giving, it's not just about that side of the equation. It's what you're getting back from it as well, right?
100%.
It feels good to give.
100%.
It feels good to be of service. I mean, these are all things. It's kind of a selfish motivation, really. You know, we benefit from the fact that we are out there making the community a better place. It makes us feel good, and we get a lot from it.
That's right.
Yeah.
Yeah. It's so true. And that's okay.
It is.
Right?
Yeah.
I once I was volunteering years ago, Dave, and I had somebody look at me and said, you know, why are you doing this? Like, who's benefiting?
Yeah.
They had a sense that I was so passionate about it.
Yeah.
You know, they're like,
Right.
are you doing this for yourself? And I was like, well, kind of. Yeah. Like, because I like to help and this is what I like to do.
Yeah.
But that's okay. Right. Like
Right.
that
It
has to
is.
be okay.
Yeah.
And I think we want to support volunteers, you know, finding their place and their passion again.
Yeah. Yeah. And look at, I mean, this is your career. You
Yeah.
get to do this every day.
Yeah.
So how exciting is that? I mean, I think that's important for people to realize is there are things that you can go out and do. You can have a really great life and make a really great living, but it doesn't mean you're not doing good. You know,
That's
you
right.
can still
Well,
do good and do that.
That's right. Yeah, a lot of people now, you hear more and more this, you know, social determinants of health and
Right.
doing well while doing good. You know, I
Yeah.
think that's actually the motto of the School of Business at Southern.
Oh, yeah?
Doing well
Okay.
while doing good.
I love that.
You know, so as you do good in the community, you can still, and you should do
Yeah.
well in your life, right? As a member of society, as somebody who has to support themselves and their family.
Right.
And I'm not saying it's easy.
No,
you know,
definitely not.
we are a small organization. Oftentimes in the nonprofit world, you know, benefits are challenging.
Yeah.
You may not have them, quite frankly, you know,
Yeah.
but you find your way through it.
Yeah. Are there things in the business that are keeping you up at night?
Oh my gosh.
Yeah. What are the big ones?
Well, I'll be honest. You know, I was just for my own health yesterday with my physician on a telehealth, and she's like, "Dan, you've got to take better care of yourself. Like you're working too hard." You know, and it's true. I get that. At the same time, I'm not sure how to change that.
Yeah,
right? Like
right.
we can sometimes be, you know, our worst enemy in that way.
Of course.
It's
Yeah.
easier to see another person and offer ideas, right, than it is to
Definitely. Yeah.
take care of yourself.
Yeah. Yeah. Viewing your own situation through that same lens that you're using on the rest of the world is a challenge.
It's so hard.
But it is so important,
hard.
you know, because think about it. If you don't take care of your health, then what falls apart?
Everything?
Everything. All of the good work you're
Yeah,
doing, all
yeah.
of the things you're out there doing. So it
It's
is
true.
extremely important. I actually just started listening to a book on Audible. Somebody had recommended to me. It's a book you might want to listen to, actually. It's 10x is easier than 2x. And it's very specific to how you approach your business and scaling it. But it talks about all of these things, all of these different strategies for how you design your work to fit your life and also scale faster. And you strike me as someone who's
Yes.
extremely passionate and ready to 10x everything.
10x.
But
let it come.
You've
Yeah.
got to design
Yeah.
your life in order
Yeah.
to do that. And
That's right.
it's weird because it's kind of it's kind of against how you would initially approach it. Like, no, I need to work harder. I need to do more. I need to find more hours in my day. Well, that's going to get you growth incrementally.
That's right.
You're going to 2x
That's
doing
right.
that, but you're going to burn yourself out.
That's right.
When you think 10x, then you can't do what you're doing the same way. What got you here isn't going to get you there.
That's right.
So it challenges you to think of things differently. And it's exciting.
Yeah. Yeah. Well, I think that's the theme for me this year
Yeah.
is how do you let go
Yeah.
so that you can grow, right? And that
Right.
it's the biggest important lesson. Quite frankly, when I worked through my MBA, like that was the thing I walked away with. It was like organizations that let go of central
Yeah,
control, right? You
right.
look at IBM versus, you know, Google. I mean, Google is like, okay, let's create this ecosystem, this playground,
Yeah.
and see where it goes, right?
Yeah.
And IBM struggled because they tried to keep everything tight,
Right.
and that control, I think, you know, you imagine as a metaphor, applying it to your own life. I just can't grow fast enough if
Yeah.
I try to do everything myself.
Yeah. It's impossible.
trying to find folks to take leadership, right, and opportunities.
Yeah. Well, it sounds like you've identified a number of people too, right? I mean, you're working with some great people.
We are, and there's plenty of space for more.
Yeah, you need more, right? That's great.
Yeah.
Are there other programs we haven't talked about?
Yeah, well, the Connecticut Garden Collaborative.
Okay, tell me about that.
And May's Closet.
Right, yeah.
May's Closet is actually, in these two instances, these programs are both DBAs of Interfaith volunteer caregivers. So, they're really kind of their own programs with their own brand. They live under the wing of IVCG organizationally. We provide support, but they have their own kind of individual purpose, which complements the overall mission of IVCG.
Do they have someone who's in charge of it?
Sort of.
Okay.
Yeah. In the case of, look, I think of opportunity managers again, trying to have me let go.
Yeah.
It means, with May's Closet, yes, there are two volunteer folks that, are the co-leads, the co-coordinators, they call themselves, and so they're the opportunity managers. And so they manage the day-to-day, and I interact with them rather than the other volunteers, right?
Yeah.
As it relates to the Garden Collaborative, I'm also the founder, and I'm the co-director of the council with another guy, Mike. So, I try to let go of more and more and have Mike take it over.
Yeah.
But, it's these programs, again, the idea of everything we do in terms of the day-to-day, the programmatic, transactional stuff all fits within this ecosystem of, who the community is and what we're trying to do. And it really comes back to the idea of building connections and compassion, right? So that we can have a better, stronger community. And if we can give voice to our seniors, which is part of the work we do with the Garden Collaborative, let's be clear, it's not about the act of gardening, although we support that.
Okay.
It's about the act of engaging in community through the lens of a garden, right? Using a garden as a theater for engagement. So we have two things we do. One is called Cultivating Connections, where we bring people together with a guest artist. They co-create art, in community. It brings seniors out of their bunkers, brings them in, meets friends. They meet friends.
Yeah.
I see them exchanging phone numbers. I'm like, okay, this is starting to work, right?
Right.
So that's Cultivating Connections. And then the other piece is Accessible Outdoor Space for All. And that's a data project, actually, that we're endeavoring to advance. And so we're collecting information about outdoor space, and we'll make that public to help people find space, get outside, find community. The sort of playful nature of our life's journey, right, that we so willingly embrace as children or in our children, right? Somehow often we lose sight of as we age. And so part of this is about how do we encourage people to let go of those social constraints so that they can be curious and discover, right?
Yeah.
Find space, open your eyes, see what's around you.
Yeah.
Right? Get out of your tunnel vision. You go from your home to the doctor and back all the time, and you just put on those blinders, you're not seeing the world. Right? And I think we need to help people reconnect and give voice to the seniors so we can inspire others to see those spaces.
So how does somebody get involved in that program?
So we have our own separate webpage for that, which is connecticutpublicgardens.org. You can see some of the program work there. You can also sign up if you're interested in volunteering through Interfaith. We have a volunteer portal. So our volunteers are able to see through an app on their phone various opportunities. They can document their service hours. They can sign up for different shifts. If it's something like our Thanksgiving for All, which we didn't even talk about, delivering 1,250 meals on Thanksgiving Day, they can sign up for specific activities all through the portal. So that's a universal sort of clearinghouse that's through Interfaith, right, that allows access to the opportunities, whether it's the Garden Collaborative, May's Closet, Thanksgiving, Food Force, everything is there.
It's all there.
Right. Okay. But in terms of its forward-facing public interaction, right, we have various ways, different phone numbers for different programs so that people can cut through the noise. Again, in this case, a separate web page.
Yeah.
Facebook page. We have 3 Facebook pages, one for May's Closet, one for the Collaborative, one for Interfaith. We'll have a Facebook group for Experience Core. So
that's great.
You asked me what keeps me up at night. I think it's starting to come together. Yeah.
Yeah. I think I'm starting to understand. May's Closet, just really briefly, that's for durable medical
equipment, canes, rollators, commodes, shower handles, whatever you can imagine. We don't always have everything.
Yeah.
Right. Again, the inventory is very much like Diapers for Dignity, where it comes through donations. People, have a rollator, they don't need it. It's in great shape. Give it to us, right? Donate it. We'll clean it up. We sanitize it, make sure it's in good working order. Sometimes we'll do even some repair work on that. And we have a central closet. We also have a satellite location in New Haven with True Care Pharmacy.
Yeah.
So good, local organization, local business. We're happy to work with them. And so people can just literally walk in and for $1 walk out with a cane.
That's great. Yeah, I mean, because that equipment can be very expensive.
It all adds up, right?
And I know their insurance only covers so much. So,
that's right.
Yeah, that's a great resource for people for sure. So yeah, I think I'm starting to understand what's keeping you up at night. Is there's too much in your head?
a lot
of things that you're doing.
But it's it's exciting time. And again, how do we grow? We need people to raise their hand to say, hey, I really am passionate about the Diapers for Dignity program.
Yeah.
Or Food Force or whatever it is, how do I help?
Right. Yeah.
Depending on their skills, expertise, it can be anything from remote work that's about, computer stuff to help us organize information to the actual interaction with our clients. Right. And everything in between.
Everything in between. There's something for everyone.
That's right.
Right.
That's right.
So plug and play, Interfaith, there's a lot of things to do.
Keep the faith.
Keep the faith.
And move forward, right?
There you go. Well, I mean, all of that sounds amazing. And I think there are, like we said in the beginning, there are so many people out there that want to give back. They want to be a part of something. They don't know how to do it. So this is a great place to start, everyone. Like if you're listening to this and you feel like you need to volunteer or give back to your community, there's no better place to start than contacting Dan and his organization and finding something to do. This is all about community. This is building up the community, making a healthier community. Mm-hmm. And I think when we do that, when we're focused on more than just ourselves, then everything gets better.
Mm-hmm. Absolutely. Absolutely. It's building habits of the heart.
Yeah, for sure.
I think back.
That's great.
Growing up, my father, I would see him take care of there were these 2 elderly ladies on our street. And he ended up getting involved and trying to help them out, groceries, bring them to doctors, and it was just like a normal part of life.
Of course.
It wasn't a big deal. It was just like, I'm going to help, and then his parents were aging and then he had to help with them, so you see that, I think, it would be a wonderful thing, right? That more young people see that as normal behavior, right? Because that's what we need.
Yeah.
That's what we need.
Yeah. That is very important. We're all in this together. So Absolutely. We have to help each other out for sure. As far as your your individual health, like what are some of the things that you do? I mean, it sounds like you don't have a whole lot of time, but what are the things that you do to try and stay healthy?
Look, my personal passion, my heart's always been in the garden. So whenever I can, I get, like to spend time in the garden. And that's good, moves the body in ways that, you normally wouldn't move in a work situation.
Yeah.
But also, this April, we just finished, I should keep it going, but it was fun. I started this thing called Spring into Health. So every Tuesday for an hour, I would force myself to just walk for the entire hour.
Yeah.
But jump onto Zoom. So if anybody needed to reach me or wanted, it'd be like office hours, right?
That's awesome.
So it's a 2-for-1.
I love that idea. That's great.
I might toy with doing that again or keeping that going. My son, my younger son's also been very interested in working out, and we got some weights at home. So he's trying to get me into that. Admittedly, I haven't built those habits yet, but
sure. Yeah.
Work gets in the way.
Never too late.
For sure.
Yeah.
For sure.
Yeah. Now, when you were doing the walk in the Zoom, did you have the camera on?
No, because it was just
Okay.
like in my pocket,
Yeah.
and I'm like, I'm just walking.
Gotcha. Okay,
Yeah.
perfect.
But
All right.
you can have conversation with people.
Oh yeah, absolutely.
So,
I love that idea.
fun.
I might do that myself, actually.
Yeah.
That's great.
It takes away the guilt of like being out of the office, doesn't it?
Yeah, yeah.
And then if nobody calls, it's just time to walk.
Yeah, for
Fine.
sure.
Yeah.
Yeah. Well, this has been such a great conversation. I really appreciate you taking the time. I'm sure you have probably 25 phone calls to get back to at this point, so I don't want to take up too much of your time.
Thank you, Dave.
But really, I just appreciate you being here. I hope that everybody's going to listen to this episode and reach out and find ways to volunteer and to give back. The work you're doing is so important and it's exciting. I'm really happy to be a small part of what we're doing with the Health and Wellness Council, and would love to find other ways to get involved. And if there are things that you have to promote, maybe when the gala is happening, definitely send it our way. But if you ever feel there's a reason to come back on or talk about something specific, just reach out. We'd love to have you back.
Thank you, Dave.
Yeah.
Yeah. We're just getting started.
All right.
40 years young.
Awesome. I can feel the energy. It's great.
Thank you, sir.
All right. Thank you, Dan. You take care. Sounds of Health is brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. The podcast is produced by Jason Carubia and Dave McNiven with music by Rob Hames. You can find us on Facebook, Instagram, YouTube, X, and wherever you listen to your podcasts. Your support means a lot to us, and we appreciate it when you like, subscribe, and leave a review. If you know someone who you think should be a guest on the show, please email us at soundsofhealthpodcast@gmail.com. Each week, we spotlight the stories, people, and resources that inspire and motivate others to improve their health, and we are just getting started. Help us to share these sounds, and don't keep us a secret.